Hi, Dr. Smith. This is Hannah Jarrison. I interned this semester at Suburban Hospital in the Community Health and Wellness Department. Suburban is located here in Bethesda, Maryland, off of Old Georgetown Road, and my office is located about 5-10 minutes away off of Rockledge Drive. And it's really close to my home, and it's in the community I grew up in, so it's been really amazing to be able to kind of be involved and give back to that community. I would say the mission of Suburban Hospital is to provide the highest quality of patient care, and that's done through excellent employees, through extensive and top-notch treatment programs, and positive and efficient outcomes. And you could say that that's the goal for most hospitals, high-quality patient care, but I've been really impressed with Suburban's drive to really be the best at what they do. It's been a really great semester and a great experience for me and great exposure to the hospital setting. Suburban's two premier departments are cardiac and stroke care, and they, like I said, are currently undergoing a big renovation to make room for increasing demand in the community. So my role as an intern in community health and wellness has been to support all of our community health and wellness projects. I've tabled at multiple local health fairs, and my mission at those fairs was to promote community health and wellness programs and classes that we had coming up, and also kind of teach the community about cancer screenings, cancer prevention, healthy habits, and that's definitely been a great experience and one of my favorite parts of the internship, getting to interact with these community members and build on my communication skills. In addition to helping with our programs, I also did a lot of typical intern tasks. I organized data, I made many Excel spreadsheets, I made flyers, and although that kind of work is tedious, I did find it really valuable, and it was a good experience for me. I feel much more comfortable using Excel, which has been something that I've been scared of for a while, so that's been kind of great to get to know. And although, creating flyers, it is kind of intern-like in nature, I really enjoy that kind of work, and it was really great for me to kind of see what I had created being used by my department in the future. So that's kind of what I did as an intern. So I would say that my greatest accomplishment, sorry about the scroll, at my internship has been those interactions with those community members, particularly educating them on cancer prevention. A lot of my focus, my own projects as an intern this semester, have been on colorectal cancer, so I really feel like I've learned pretty much everything there is to know about that disease besides the actual, physiology of it. But in terms of prevention, what age you want to be, what age you should be when you get screened, what puts you at higher risk, all of that information I was able to give back to community members who were really genuinely interested in and were listening to me. And I felt really accomplished because talking to people, to strangers, about things like colonoscopies and colorectal cancer, and I also had some experience talking about breast cancer. These are kind of squeamish topics, and I was really able to effectively communicate to them, and they seemed to consider me someone who knew what they were talking about. So that was a really great experience for me, and I feel very accomplished knowing that I got that information across to people. So my greatest challenge, I would say, at my internship was the repetitiveness of my tasks. I was working a lot on colorectal cancer, and although that was a great experience and it provided me with all of this great knowledge, it was supposed to be Colorectal Cancer Awareness Month, and it kind of felt like it became Colorectal Cancer Awareness Semester. And I was really pushing to kind of move on from it and get new tasks, but it was really a big focus of my semester. And so a challenge for me was to go to my supervisor and say, hey, I kind of want something else to do. Are there other things for me that I can focus on? Because I know we have so many projects and so many amazing things. And it was challenging to go to her and ask for something like that, but it ended up being really rewarding, and I ended up getting involved a little bit in our diabetes prevention and tobacco cessation. So although it was challenging to have that conversation, I'm really happy that I did. Another challenge of mine was just my time limitation. Community health and wellness hasn't had a part-time intern in the past, so I was the first one. I was kind of like the test run. So originally the women in my department were kind of wary to pile on and give me tasks because they knew that I had such limited time. And again, I just had to push myself to go up to them and say, hey, I have these things going on, but I'm also not super busy today. Is there anything I can help you with? And that was a really good lesson in communicating with superiors and, learning how to communicate professionally with people in the workplace, which I think will benefit me a lot in my career. So lessons learned and how they impacted my professionalism. I would say, again, the skill that I developed the most was the communication, which is critical in any setting. So after graduation, I'm starting a Master's of Science in Nursing program in the fall. And being a nurse and communication very much go hand in hand. You have to communicate with patients, doctors, your nursing supervisors, families, and a lot of these people are turning to you for these really important answers. So having the exposure of talking to people, strangers really in the community about health issues, and kind of knowing how to approach it and not worry people, but also get the information across that they needed to know, I think is really going to help me in my career. And also the challenges of stepping up and asking the women in my department for more work or to move on for more challenges, that is definitely going to help me interact with superiors of mine in the future in nursing school and beyond. So I definitely feel like this whole experience was a lesson in professional communication. And I've had jobs before, but this has definitely been definitely the one that's most relevant to my career. So communication in a healthcare setting has been a really big takeaway for me. And so some of my public health science classes that came up in my internship, the one that came up the most was public health biology, PHSC 415. A focus in that course is blood pressure, cardiac disease, and I really did learn a lot in that class. It was probably my favorite from my major. And a big thing that Community Health and Wellness does is we do free blood pressure screenings for the community, mostly in senior centers in the area. And although I didn't get to go to one of those screenings myself because of my time limitations, I had the proper training just in case I would ever find myself there. And it was nice to kind of have that background on blood pressure and understand what it means to have high blood pressure, know what numbers are too high and really concerning, know what numbers are average. So that kind of made that learning process easier, and it came up a lot for me throughout the beginning of my internship, the training part. And then another class that really came up for me was my capstone. I wrote my thesis on the effectiveness of tobacco intervention, which really was inspired by my internship and the intervention work that my department does. So I was interested in what methods of tobacco intervention and cessation plans are the most effective. So I wrote my entire thesis on that, and my department does do tobacco cessation classes for the community. So it was nice to, my supervisor had asked me a few questions about it, and just to be able to apply the knowledge that I had gained from my capstone into these community programs. So overall, this has been a really great experience. I really enjoyed my time at Suburban. It's, again, been nice to, I've driven past it my whole entire life, so being able to work there and really be a part of it has been a really great positive takeaway for me. So thank you for the opportunity, and I look forward to applying everything I've learned into my new job as a nurse.